This is Professor Michael Chapman. I'm one of the most experienced IVF doctors in Australia. I believe that an important part that I can contribute is to educate patients in relation to fertility, infertility, and all that involves. These series of podcasts help to educate you. I hope they are helpful to you. If you wish to know more, however, I'm more than happy to have you contact me via email, which is profmchapman@gmail.com, or make an appointment to see me on 9138 4222. One of the dilemmas that we have is if you have severe endometriosis and you've got endometriotic cysts in the ovary, at some point they're going to have to come out. But when we do surgery, and no matter how good your laparoscopic surgeon is, when you take out the endometriomas, you are damaging ovarian tissue and you reduce the number of eggs that are actually left in the ovary. So these days, and I quite often recommend it, is that we actually, if you're going to go through IVF, do that IVF now before you have the surgery. We freeze the embryos and they sit there waiting for us to come back after we've done the surgery and putting them back into an environment which is going to be more likely to allow you to have a pregnancy. So endometriosis is a significant part of the fertility story. The next time that we do a laparoscopy for endometriosis after somebody that's got symptoms and or an ultrasound diagnosis is a patient who's had multiple attempts at embryo transfer, and although she's got no symptoms or signs of endometriosis, it is still worth excluding, and that's where the laparoscopy comes into play. So laparoscopy is an important tool in the patients where we have difficulty getting them pregnant after multiple embryo transfers. In the longer term, once the fertility is sorted and if symptoms persist after having that baby or having decided to stop fertility treatment, there are very good treatments available these days to suppress endometriosis. They include drugs that suppress the pituitary and the hypothalamus, and in doing so create what's called a pseudomenopause. And that works really well in terms of symptom relief. 70 to 80% of women have improvement. And there's another compound recently on the PBS, Visane it's called, and that has estrogen and progesterone in it. It's a bit like the contraceptive pill, but more potent because it's got a better progesterone in it. And over time, that will also improve symptoms significantly. So things are changing. Medical treatment is now a possibility if fertility is not what one's looking for. But if it's fertility, you need to see a fertility specialist if you have endometriosis, preferably a laparoscopic surgeon who understands that fertility doesn't mean ripping out your ovary. Or significantly damaging your ovary, and talking about the possibility of actually collecting eggs before you have the endometriosis surgery. So it's a difficult problem, but in most cases we get a good result. And don't forget that you can access all the previous episodes by going to our website www.theivfjourney.com and select IVF Journey podcast from the navigation menu.